most common female genital aesthetic procedure is a labia minora reduction, or labiaplasty. A newly released statistical study from the American Society of Plastic Surgeons emphasizes the growing popularity of labiaplasty surgery, showing a 30% increase between 2005 and 2006 alone. A labiaplasty, once an almost unknown procedure, is now a frequently requested one. The purpose of a labiaplasty is to reduce and balance the size of the labia minora, or inner vaginal lips. There are many factors which have contributed to the rising popularity of labiaplasty surgery, not the least of which is a growing understanding of large labia minora as a real problem with real symptoms. And in addition to being a purely aesthetic problem, many women complain of some degree of discomfort in tight clothing, as well as during exercise and sexual activity. An abnormally large labia can also be a hygienic problem, causing constant irritation. Thanks to recent media coverage, the demand and request for the procedure is on the rise. Personally, I've had exceptional training during both my general surgical years and plastic surgery fellowship in performing sexual reassignment surgery, as well as the full spectrum of urogenital reconstruction. Although I no longer perform sexual reassignment surgery, this experience has been invaluable while performing labial reduction surgery and clitoral hood reduction. The first labiaplasty I performed was almost by chance. A nurse at a local hospital inquired about the problem at the same time as her breast augmentation. Awareness of labial hypertrophy as a medical condition with a whole set of symptoms was just about unrecognizable at that time. Since this time, about 10 years ago, the procedure seems to grow in popularity every year. In our series of patients, the majority are between the ages of 20 and 49 at approximately 85%. Most patients have a reduction on both sides, but there is a definable request for unilateral or one-sided repair at about 8%. Greater than 80% of our patients request the procedure secondary to discomfort, either in clothing or with sexual activity. The most common procedure performed in addition to labial reduction is clitoral hood reduction, followed by episiotomy scar revision and excision of vaginal polyps. Complications have been relatively infrequent, with wound separation being the most common at less than 3%. After surgery, our patients are asked to complete a questionnaire related to their satisfaction with the procedure. This is done in an attempt to develop evidence-based modification of not only our techniques, but with our overall patient care. With our current technique, the overall satisfaction rate is high at over 95%. Overwhelmingly, our patients have reported improved self-esteem, improved sex life, and happiness with the procedure. Almost all would do the procedure again and recommend a labiaplasty to other women with similar complaints. A labiaplasty is a technically challenging procedure and greatly benefits from the skills of a plastic surgeon. A labiaplasty can be performed as an isolated procedure, either under local anesthesia or under general anesthesia. At Prima Center for Plastic Surgery, we have the only AAAASF accredited office surgical facility in our area, and we use only board-certified anesthesiologists. The current technique that I use essentially removes a wedge-shaped portion of the labia minora, preserving the underlying subcutaneous tissues. With labial hypertrophy, the inner labia minora are enlarged or lengthened. The labiaplasty is usually performed by removing a wedge-shaped amount of extra tissue, preserving the underlying subcutaneous tissue. This helps prevent complications. In addition, if there is excess hooding over the clitoral area, this can be removed at the same time. The average operating time is 1 to 1.5 hours. We have a fully equipped and well-trained office staff at Prima Center. We use our private surgery center, and this has been very comforting, especially to patients seeking this highly personal surgery. We do our best to make every patient feel at ease during the entire process. If any further questions, please let us know. More information is available at primacenter.com. Thank you.